everybody, welcome to my channel Island Daily. My name is Dr. Aman and I'm an optometrist, and today we're going to learn Bielschowsky's Parks 3-step test. So let's dive into the video. So the Parks 3-step test is used to check the cyclo-vertical deviation, and as the name suggests, it consists of three very important steps to rule out the paralytic muscle, right? Now, you're going to take a case scenario. So, the step one says that you have to observe the eyes in the primary gaze, right? So, let's say we have hypodeviation in the right eye and hyperdeviation in the left eye. Now, what does this mean? Now, this means that we have palsy of right elevators and we have palsy of left depressors, right? So in elevators, we have superior rectus and inferior oblique, and in depressors, we have inferior rectus, and superior oblique, right? Now, the next step is we have to check it in horizontal gazes. We have to check it in right or left gaze, right? So let's say if the deviation worsens on the right gaze, right? So it worsens on the right gaze. Now, what does this mean? This means that the eye is actually the right gaze is right over here. So this means that so this is the right gaze, and in the right gaze, the deviation actually worsens, right? Now, we know that on the medial side, we have oblique muscles, and on the lateral side, we have rectus muscles, right? So, which means we are going to highlight the muscle acting on the medial side is actually the superior oblique muscle, right? And the muscle which is acting on the lateral side of the right eye is actually the superior rectus muscle, right? Now, now we have ruled out superior rectus and superior oblique. The step three is head tilt, right? So in head tilt, you have to tilt the patient's head in right and left direction, right? So according to the vestibulo-ocular reflex, if you're going to tilt the patient's head on the right side, the eyes are actually going to move on the left side. And if you're going to tilt the head on the left side, the eyes are actually going to move on the right side. So this is the vestibulo-ocular reflex. Now, we'll say if the condition worsens on the right head tilt, right? So now the condition is worsening on the right head tilt, but the eyes are going to move on the left side, right? So now the eyes are going to move on the left side. So this is the cyclo movement, right? This is the cyclotorsion, right? Now we know that superior muscle are intorters and inferior muscles are the extorters, right? So now what? So it worsens on the right head tilt and the eyes are going to move in the left direction. Now what? So the, right over here on the right side we have inferior oblique, which is extorter, right? But right here the eye is actually going into intorsion. So we are going to cancel this muscle, right? Now what is happening right over here? The eye is actually going into extorsion, and we know that the inferior muscles are responsible for extorsion. So the responsible muscle, the paralytic muscle, the right term is the paralytic muscle is the inferior rectus muscle. So this how you are going to locate the paralytic muscle. You are going to diagnose the paralytic muscle, and this was the part 3-step test. I hope I have made everything clear. So till then, take care of yourself and please like and subscribe to my channel. Thank you very much.